Thank you, Sandra. Just achieved the first objective, which is to switch the mic off before I start speaking. It actually really interesting listening to Julie's presentation because it put me right back to Nye Bevan in such similarities. So for the listeners, the Nye Bevan program is another one of the NHS Leadership Academy programs, but it is for people who are already quite senior, who maybe have their eye on becoming an executive director. Now, I wouldn't say that was my aim initially when I started, but I had done a little bit of stock taking in terms of my career and where I was at. At the time, I was Director of Nursing and Therapies for our children's division at that time, so already quite senior. But my son had just gone off to university and I was looking through my CV and I thought, well, I haven't done any studies for a while. So I had to look around to see what was available. And a colleague had recently completed one of the leadership programs, so it made me look on there. And although, as I say at the beginning, I wasn't thinking necessarily to become an exec director, what I saw about that program was it was all going to be about leadership, which I thought would be useful in any case. So I've just put very brief headings on the next slide, which I'm just going to talk through. And so a little bit like Julie was saying, the structure was very much about leadership, but there were three elements of focus, which was the patient voice. So as leaders, what were we doing about listening and doing something about what we were hearing? Definitely the whole equality, diversity and inclusion agenda. And this was in 2019, again, very interestingly. The program started in February and it finished in December. And then the third kind of big element within that program was self and peer assessment. So a lot of what we've just heard described there about 360s, but it wasn't just that. There was a lot of self-reflection. There was a lot of tools that you used as an individual to understand yourself and leadership styles. It was residential because this was before COVID. So we gathered in Leeds. I would say, echoing Julie's point, looking around the room of about 100 senior leaders in the NHS, it was mostly white. We did a lot of work around that black and white and the language, and again, from all over England. And we got into kind of small learning sets of between 6 and 8 people. And we, as well as meeting in Leeds, we also met each other in our learning set in the office of one of the teams. So we took it in turn. So we were in London, we were in Leicester, we were in Newcastle. So very much that kind of building a network outside of your own small circle. Lots of homework, all done through a really excellent online portal, lots of things to read, videos to watch, and lots of homework. For anyone who is considering that step, one of the things to be really conscious of is it's a peer-assessed program, and that was completely new to me. So it meant that in our action learning set, we judged each other's work, or assessed each other's work, might be a better word. So depending on whether you progressed or not, depended on how well you presented your learning to that group. And we had lots of debates and discussions, and anyone could challenge the other. And whilst there was a facilitator, and that person could comment on what he or she was hearing, they ultimately didn't decide. It was the group that decided whether any member of the group had presented their homework well enough to be deemed to have met all the learning criteria. And the focus of that really was that when you're at a senior level, that you are likely to be in meetings where you may have to challenge or critique something presented by a peer from your own organisation, or indeed from another organisation. So it's kind of trying to get you to build those skills, to be confident to say, I disagree with you on that point, but being able to rationalise it and give a good explanation. So I think for me, the kind of key learning was the patient feedback process. And we had a lot of processes in place, but it made me really think about how effectively we were using it in our children's department. It made me think also a lot more about racism. Through my career, which spans many years, I had done various modules over time, and I had touched a little bit around racism in the NHS. So I had some understanding, but absolutely acknowledged it was quite limited. And the other key thing was understanding myself and the leader that I am, and how I had developed that style. So there was a lot of that analysis and use of tools to see, how did I become to be this leader? And does this leadership style suit all situations? So, and a lot of that kind of detailed discussion happened in the small groups, where you could really get into the detail of things. No one was allowed to just skim over and make a sweeping statement. You had to really kind of unpick why this happened, why you thought that happened, and so on. So in terms of how then I applied that in practice, so certainly within Children's Division, we had started to have conversations around patient stories and what we were doing with them. So we built them in as an automatic element of our monthly quality and performance meetings. And we were in that way then able to celebrate the good work, because often they were good news stories. But also, if things hadn't gone well, say it was based on a complaint, we were able to see how we could change practice and spread that across, because at that time our team was made up of staff across 9 different London boroughs. So what we learned in one borough, we were then able to share in that meeting and hopefully improve the same kind of service delivery right across our division. The other thing for me was that as I said, I had some understanding about racism, but I really was very uneducated, I would say, around unconscious bias, particularly on white privilege. And that was something that was done very well on this programme. It was really about getting particularly the white staff to think about what it is to live as a Black or brown person every day. And they use different tools to help us with that. And it was managed very well in a very supportive way. And people were asked to share their thinking around that. And people were very forthcoming about, possibly for some people who didn't live in a multicultural area, they possibly never thought about some of those things before. But we were constantly challenged then about, well, the so what? So now you've developed this understanding, what are you doing with it? So it was very much about coming back in and becoming an ally. So joining the different Race Equality Network or the Disability Network and the other networks that we have in this organisation, and to start to talk about what I had learned and bring those conversations into our divisional senior team meetings so that we could challenge our own understanding. And then we had some fantastic conversations with our Black managers about what their experience was of being Black in the NHS and things that the white colleagues had no understanding of. And the other thing that came out for me, which I think really is about education for white staff generally, is that, are we afraid, as Julie was just saying, are we afraid to say someone is Black or brown because we're nervous we might cause upset? So I think there's something about education of the whole department so that you can have those conversations and build your understanding and be able to say to your colleague who's from a different ethnic group, can you explain to me about whatever it might be, about the kinds of food that you eat or the religious ceremonies that you attend? So for me, there was a lot around that, further developing my own knowledge, but bringing that challenge into the divisional discussions. And the other thing I did, which seemed quite simple, but hadn't thought of it before the programme, was just expanding my network on LinkedIn and Twitter to have more people who champion EDI, so that I was then able to see the kind of things they were posting, articles, further workshops, and some reading, some wider reading. People may know June Sarpong. She's written a lot of good books. You know, kind of led me to her. And her book has a lot of little exercises in that you can do if you really want to develop your knowledge and understanding. So I would definitely recommend that. The other element too was networking.
Sorry, Sheila, just going to give you a 30 seconds reminder, if that's okay. Yeah. Sorry.
Yeah, networking both internally and externally. And I would say the final bit was in terms of being courageous and really developing my own sense of the purpose that I had as a senior nurse to champion for patients as well as staff. And I just had one example where there was going to be quite a debate about a particular contract, and it would have been easier and simpler to say, okay, but I couldn't in all conscience agree with it. So I made my views known, knowing that it would result in a trust board debate, which it did. But I felt validated, and I felt I had developed enough courage and confidence to be able to have that conversation. So would definitely recommend that Nye Bevan programme.
Thank you, Sheila.